your thoughts, if you're comfortable offering them, about the fact that oncologists don't tell patients that these diagnostics exist. Like they're part of it is their education, but like, what are the barriers to doctors just saying, hey, sadly, my facility cannot provide you the most thorough diagnosis. Go here, get that, and come on back with the data.
Right.
It just doesn't happen.
Well, there's a couple of issues. One is the oncologists are often uncomfortable with the testing. They don't fully understand it. Some of them, I've had patients who have been suggesting liquid biopsies on, say their oncologist says, I wouldn't even know what to do with the data. So that's kind of alarming. Like, this is a technology that's been around 20 years.
Life-saving.
Yeah, absolutely. And then there's a concern, well, what if they find a treatment, we don't offer it here? Now what are we going to do?
Yeah.
So there's so many barriers to that an oncologist is going to try to discourage it, because it's going to give them a headache.
That's
so
right.
Like, I've got 40 other patients.
Yeah.
Now I've got this one that's sort of acting up. How am I going to manage this?
You've got hundreds of patients.
Exactly. Typical oncologists will see 200 new patients a year, plus their ongoing patients that could be hundreds and hundreds, thousands in fact. So the oncologist simply doesnn't have the effort, the energy, the capability, or the time to really focus on precision medicine. That's lacking in the system. Our system is moving from one size fits all, like cookie cutter, and oncologists could do 200 patients like that. Now when it's every patient is a unique patient, it's like the system is unwinding, and it's creating a real problem.
Yeah, and again, as we were just saying, it's leading oncologists to just not even shine a light on something that patients themselves could do, because as you're saying, patients can take it upon themselves to call yourself or call CTOAM and get some testing.
Absolutely.
Have a far more thorough diagnosis, have advocates then help educate the doctors on what to do with that data.
Yes.
But the doctors aren't even telling them. I've had many conversations with doctors who have said, well, I just don't think Mrs. Smith could afford anything. Right. And they're making the decision for themselves, for Mrs. Smith.
They have no idea whether Mrs. Smith can afford it or not, or wants to do it. And this is an important thing. The system is flawed in that we don't have proper educational platform. And that's one of the things we're trying to build at Protean, is actually a platform that any doctor can plug into, will guide them. These are the tests that are indicated. If they need support, we can communicate with them and explain why and help them so they don't feel abandoned dealing with the test. That we're like their virtual colleague, saying, okay, I can call on you to help me guide this patient through. Now I feel confident you're actually using proper guideline, proper science, proper ethics, properly taking care of these patients, best available care. We need to build that trust with the patient and the doctors, because that's what we're trying to do. We're trying to move medicine forward, move it forward from general one-size-fits-all, precision medicine, personalized for each individual. Every patient's a unique individual. They need to be matched to the right therapy for them, needs to be tailored, needs to be adjusted, needs to be adjusted so they don't have toxicity, so they have efficacy. And if it stops working, so it's discontinued, so that they don't continue to have unnecessary toxicity. That's the future of medicine.
It's here.
It's here.
It's possible.
It's happening today and now.
Yeah.
Our challenge is to make it more and more available to everybody. That's our goal.
Yeah.